to this. So an interesting one, if you're interested in kind of vasculature like vessel networks, blood, and possible bone stories. Osteoporosis is probably going to be the most common bone disorder you come across. It's the most prevalent in the United States, especially among older adults. In this story, our friends, the osteoclasts, outperform the osteoblasts. So there's going to be far more bone degradation, so removal of bone, than bone being built. What happens there is it causes kind of brittle bones, as you can see on the right in the spongy bone network. It can create weak and brittle bones down the road. Highly encourage this one if you're looking at going into med school or nursing or the health sciences, because you'll get a lot of patients coming in with this complaint. On the flip side, the opposite of osteoporosis is osteopetrosis, which is also known as marble bone disease. Ooh. This is when bones become too dense. So unlike osteoporosis, where the clasts were the ones that were doing all the work, this is where the osteoblasts are actually outperforming the clasts. So there's way more bone being built than being removed. And what that does is create this like really dense marble type bone network. And you would think you would have like Iron Man-like qualities as a result of this. But it's actually the opposite. Your bones, because they become so dense, it really throws things out of whack in terms of where minerals are deposited, where calcium's deposited, and the bones they break really easily as a result. I referenced this one last week, osteogenesis imperfecta, which is also known as brittle bone disease or Mr. Glass disease. This is a genetic story, actually. It's a genetic mutation that impacts collagen. So collagen, if you recall, is the protein that makes up, one of the proteins that makes up the bone matrix. And the other diseases we were talking about, those kind of degrade bones like after the fact, like retroactively. This one actually creates imperfect bone formation. So it's actually a story that is affecting how bones are being built, essentially from birth. So as a result, bones are super easy to break. Patients also experience hearing loss and deafness, and they have a small stature as well. You'll see on the right there, you see kind of the Swiss cheese holes in the diaphysis, the midsection of the bone. That's a common characteristic of osteogenesis imperfecta. And the final two stories, starting with leukemia, these are more related to bone marrow. So if you want to kind of explore stem cells and cancer stories, this one might interest you. And it has to do with how cancer or immature white blood cells are overproduced in bone marrow, and they actually crowd out all the normal blood cells that are supposed to be produced. It can lead to a lot of other harmful diseases down the road. So if you want to explore cancer, stem cell, or bone marrow stuff, this could be a cool one for you. And related to that, multiple myeloma is another bone marrow cancer story. This one has to deal with plasma, or abnormal plasma cells being produced. And it actually creates a bunch of abnormal antibodies too. So that's your body's defenses for flagging infection and fighting disease. So this one can lead to a lot of nasty diseases down the road as well. We got multiple myeloma, leukemia, osteogenesis imperfecta, osteopetrosis, osteoporosis, necrosis, and that's that. So I'm going to pull up. It is cool to see the x-rays, Ms. Asher. And related to that, we're actually next Tuesday, if you saw on our schedule, we're going to go over lab testing. So we'll go over next Tuesday the diagnosis piece and what kind of lab tools and imaging you can use to flag and diagnose these diseases. So based on what you saw, I'm going to throw link in the Jamboard here. Want you just to open that up and get a preview. At the end of class today, we're going to